steps that must be completed prior to indwelling butterfly needle placement are 1. Obtain the intravenous conscious sedation tray from the surgical dispensary. 2. Prepare the intravenous fluid bottle and syringes. 3. Monitor blood pressure, pulse rate, and respiratory rate. Record the information on the intravenous sedation record. Assess the quality of the dorsal venous plexus of the veins and place the rubber tourniquet under the lower forearm. It is preferable to use the patient's left hand. Bring the tourniquet together on the top of the arm and hold the crossed portion of the tubing between the thumb and forefinger of the left hand. With the right hand, grasp the right tubing and stretch until sufficient tightness is developed on the lower forearm to occlude venous return. As the stretching starts, the hold of the thumb and forefinger of the left hand is released. When the stretching is completed, the crossed portions of the tourniquet tubing should still be between the thumb and forefinger of the left hand. When the correct tightness has been obtained, the thumb and forefinger of the left hand reapply their hold. The right tubing is released and placed above the restraining tourniquet loop. The forefinger of the left hand now pushes a loop of the right tubing under the restraining loop from above, downwards. The tip of the loop is grasped by the right hand and pulled under the restraining loop a short distance. The thumb and forefinger of the left hand now release their hold on the tourniquet. The forefinger is pulled from between the restraining loop and skin, and the restraining tourniquet loop now lies tight upon the skin surface. Note that the ends of the tourniquet are free of the puncture site. The sterile alcohol pack is obtained to prepare the skin surface for needle puncture. The packet is opened and the alcohol sponge removed. The 21 gauge sterile butterfly needle packet is now obtained. The top cover is peeled back and the butterfly needle with plastic line is removed. The plastic sheath covering the needle is removed. Exercise care not to touch the sterile exposed needle. Increased vein distension is obtained by lightly slapping several times with the right hand the vein selected for needle puncture. The skin surface is now cleansed by rubbing the alcohol sponge over the puncture site. To maintain venous distension, the alcohol sponge is moved over the surface of the skin, primarily in the direction of venous blood return. The patient's hand is now grasped with your left hand by placing the little finger over the top of the patient's fingers and placing the second and third fingers of your left hand under the patient's fingers. The forefinger and thumb are now placed upon the patient's hand. The operator's thumb is always placed in a position that will be slightly below the puncture site and is used to retract the skin surface backwards at the moment of needle puncture. The butterfly wings are folded together and are held between the thumb and forefinger of the right hand. The bevel of the needle is up. The puncture site is directly over the vein. The needle is advanced into the lumen of the vein its full length. Note the thumb of the left hand holding the skin surface flat by providing a slight backward retracting pressure at the moment of puncture. A successful vein puncture will be indicated by a slight backflow of blood into the plastic tubing. The butterfly wings are now folded down onto the skin surface and are held down by the thumb of the left hand. The right hand picks up the free end of the plastic tubing to remove the end cover cap. When the end cover cap is removed, blood will begin to flow through the tubing toward the free opening. When all air has been displaced from the tubing by the blood arriving close to the free end, pinch the plastic tubing between the thumb and forefinger of the right hand. The end cover cap of the intravenous infusion line is next removed and brought into position by your assistant. The intravenous infusion line from the dextrose 5% in water bottle is attached to the connection hub of the butterfly needle plastic tubing. The right hand pulls the right tubing loop from under the restraining loop, and the tourniquet is thus released. Note the continued hold of the butterfly wing by the left hand. The right hand now opens the fluid line by rotating the plastic screw clamp. 1-inch paper tape is placed over the butterfly wings. Note the loose tourniquet as fluid flows through the needle into the vein. The excess plastic tubing is now looped over the butterfly needle placement, and a second 1-inch strip of paper tape is placed over the plastic loops. The connection of the two tubings is placed over the dorsal surface of the hand. A third strip of paper tape is placed over the tube connections. The rubber diaphragm injection port is being displayed by the left hand. The injection port is cleansed with an alcohol sponge, and the needle of the plastic syringe is placed through the rubber diaphragm. The conscious sedation agents are now slowly injected. At the completion of the dental procedure, the butterfly needle is removed by first turning off the intravenous infusion line and then removing the paper tapes. Note how the thumb of the right hand holds the butterfly wing as the last paper tape is removed. An alcohol sponge is placed over the puncture site prior to removal of the needle. The needle is withdrawn by the right hand, and the left hand applies immediate pressure to the alcohol sponge over the puncture site. When no bleeding is visualized from the puncture site, a spot Band-Aid is opened over the puncture site. The spot Band-Aid is then pressed to place over the puncture site.